right. Thank you so much for that warm introduction, Dr. Scheinberg. And I'd like to thank the Purina Institute for inviting me here to speak. It is really my honor to be here. The title for this first talk is You're In for a Challenge. Clearly, I let ChatGPT name my lecture. If you are ever bored, you can go to AI and ask them for urinary puns. You get some very interesting things that come out. So it's just fun. It's how I spend my time, all right? The financial disclosures are listed here. I do want to mention one. The UC Davis Stone Laboratory is sponsored due to a generous gift from Nestle Purina. They sponsor and pay for the technician, as well as all the stones that are submitted to our lab are complimentary to the veterinarians. We accept stones worldwide, and the consultations are also free. Having said all that, I can tell you that none of that is impacted or will affect any of the data that I'm presenting this afternoon. And the rest of the disclosures are listed there. All right, so we're going to talk this afternoon about feline lower urinary tract disease to start, okay? That is FLUTD. Have you all heard that term before? That acronym? I see head shaking. So FLUTD is an umbrella term used to capture a variety of different disorders associated with the urinary tract. Things like urolithiasis, urinary tract infections, and of course, feline idiopathic cystitis, which in my opinion and probably yours are the most challenging cases to deal with and what I'll focus on this afternoon. Unfortunately, FIC, we don't know the exact cause for, which makes it even more challenging, and can be obstructive, primarily in those male cats, right? They have that really tiny distal urethra and can obstruct, or non-obstructive, which can occur in the male or female. Now, that literature citation I have listed there, I'm almost embarrassed to say, this I think was the very first publication I ever had, and it was a long time ago. It is the first chapter to my dissertation that I was so thrilled and honored to be able to work under the mentorship of Dr. Tony Buffington, who's done so much, I think, to revolutionize how we manage these cats. And he was the first, and I worked with him, to look at the cat as a naturally occurring model for bladder pain syndrome, or IC, in humans. And so throughout this talk, I am going to look at some data in humans, but I like to look at humans as a naturally occurring model for our cats. How can data in humans help our cats? And of course, then, how can cats help humans? Looking at FLUTD in general, any of those lower urinary diseases carries about, depending on the study, 1.5 to about 4% prevalence, okay? If you look at cats with lower urinary tract signs, almost up to 2/3 of them are going to be idiopathic. The majority of the lower urinary tract diseases we see are FIC. And the worst part is 40 to 60% of those FIC cats may be recurrent. They're going to come back to your practice time and again because the cats aren't getting better and they're relapsing. And even we have more trouble with those blocked cats. Your recurrent urethral obstruction can be as high as 58% at about 3 months. And that costs the owner a significant amount of money. It could result in euthanasia. Or, as Dr. Lappin said, he likes to keep those cats out of the shelters. And unfortunately, lower urinary disease is a big reason why cats end up in shelters. I'll mention too later, another differential though for lower urinary tract disease is urolithiasis. And depending on the study you look at, about 25% of cats with lower urinary tract signs will have a stone in their bladder as the cause for those signs. And keep that in mind because that's going to help us decide what diagnostics we want to do for our cats when they present to us. So FIC in general, it is a worldwide disease. I picked this disease as our most challenging because we do see it everywhere. By a show of hands, how many of you all either see FIC cases or receive consults about them? We've got almost a unanimous vote. And I'm sorry to say that, right? We don't want to be seeing these cases, but I think that shows how important it can be. And I found another citation that said up to about 25% in one study they found it was a reason for euthanasia was FIC. So hopefully we can start doing a better job at managing these cats and preventing that awful case scenario. So I want to talk for a second about humans, okay? Humans have their term, it's changed, we call it bladder pain syndrome, or BPS/IC. There is many similarities between cats and humans. I'm not going to go into all of them. In the human field, there is the International Association for the Study of Pain, or the IASP. They classify pain, and we'll talk about this later, as being nociceptive, which is visceral pain or tissue damage. I think of it as visceral pain because I'm looking at bladder pain, right? These cats are voiding frequently and they hurt. Or it can be neurological pain, and I'll show you some evidence that this disease can have neurological pain too. In humans in 2019, the IASP classified BPS/IC as a chronic primary pain condition. So it's a pain condition that lasts more than 3 months. It's often associated with stress. I'm sure we've heard, you guys all know FIC can be associated with stress. Same thing in humans. And or it can have some functional disabilities associated with these patients. So what have we learned from cats? Let's focus for a second on the nociceptive pain. If you see that little cartoon schematic there, that is of the bladder urothelium. And those larger cells you see are the umbrella cells, and they interface with the urine itself, okay? And if you look at the scanning EM, you can see in that label B, that is a healthy cat, and all of the cells are nicely stuck together, and there's no evidence of the underlying urothelium. You don't see the intermediate or basal cells. And even in that middle picture of the EM, the bladder's really distended, but those tight junctions are holding everything nice and closely together. As opposed to the last photo, that's an IC cat. And you can see that denuded uroepithelium. And some people, you'll think about urine. It's high in urea, it's high in potassium. And that potassium and urea has now got access to those underlying nerve fibers that might result in a painful experience for the cat. And in humans, there was a test that wasn't abandoned long enough ago. It was called the potassium sensitivity test. And in a woman, they would instill a potassium-rich solution into her bladder. If she screamed that it hurt, she had IC. That's awful, but I think it shows how painful it can be. Other studies in the bladder that we found looking at nociceptive pain, these data come from Dr. Berter at the University of Pittsburgh. She looked at bladder strips from cats. She has always taught me that the cat little urothelial cells are almost like little neurons. And the cells from the cat bladders, when they distend, they can increase serotonin release that's seen on that right graph compared to controls, and increase non-neuronal acetylcholine. They also, based on that cartoon there, will increase ATP and nitric oxide. And when that happens, it's going to go back and it's going to stimulate the bladder afferents. You get a lot of recruitment of C fibers under pain condition. You get numerous C fibers that are activated that are then going to release more substance P. Substance P is going to act on those NK receptors, and it's going to have this paracrine effect where the bladder is going to get wound up and very inflammatory. And it's this dysregulated activation of these sensory C fibers that leads to this severe pain, right? I could spend a lot more time talking about all the bladder abnormalities, but I just wanted to present a couple of slides showing what we've learned from cats that demonstrates to me as the internist and clinician how poorly they might be feeling. The other area we looked at is their altered stress response system. The citations you see there were from data we acquired quite a while ago, but we looked at the evaluation of the effects of stress in these cats. And what we found is when cats were stressed, we took blood samples, and their stress, we moved their rooms, we changed their food. It wasn't that bad. It's something that could happen in a home, right? We didn't torture cats by any means. And what we found when we took their blood samples is their catecholamines were really increased compared to controls. Both norepinephrine, epinephrine, and even their metabolites. Now, I'll talk about environmental enrichment. This will lower those catecholamines, all right? It's crucial. Now, I expected to find, if you look at that last citation, if you're really stressed, don't you think your cortisol should be all revved up, right? Your adrenal gland should be squeezing out cortisol. Well, what we found in these cats is that their adrenal glands are really tiny, and they're actually not producing as much cortisol. So we found this altered response where the sympathetic system is all geared up, and their hypothalamic pituitary adrenal axis is blunted. And these same findings have been found in comorbidities in humans with IC, like fibromyalgia, chronic fatigue syndrome, chronic migraine, and even in some IC patients in humans, okay? So we don't know yet what actually ties those abnormalities in yet to bladder signs. So we don't really have a definitive cause, so we need to continue the research. But what we can do a better job at now is knowing what we know, we might be able to help prevent it or at least to manage it. Because just because we don't know what causes it doesn't mean we should stop treating it, all right? We'll work on both. So we're gonna look at this as far as addressing risk and protective factors. So a lot of the information I'm going to talk about now comes from this recent publication we did looking at the cause of FIC, kind of a new hypothesis, if you will, as an imbalance of risk and protective factors in this disease. So if you have, it's like a little balancing act where if your risk factors are really high and you have no coping strategies, nothing in there to palliate the signs, you're going to have real severe disease. If we can make that more level by optimizing the environment, maybe increasing hydration, this will help put the cat back online and maybe tilt things in our favor. So we look at now what I call the 5 Ps for feline idiopathic cystitis. And I'm going to go through each of these and highlight a couple of the features that I feel are kind of most relevant as a practitioner, looking at predisposing factors, precipitating, perpetuating, palliating, and preventative. Don't try to say that fast. Now, within each of these categories, too, there are environmental, psychological, and behavioral. I'm not going to go through them all, but that article you can download. It's open access. So when I think about predisposing factors, I think about intrinsic and extrinsic. So intrinsic being, genetics or epigenetic gene expression, right? What's going on in that cat? We know in humans, IC can run in families. There are studies looking at twins with the same phenotype. We know certain cat breeds, right? The Persians and Himalayans come out with increased risk when you look at various studies. Male cats, middle-aged and neutered, have been found to be risk factors. Dr. Lin mentioned a lot on some of these sickness behaviors. Some of them, like even obesity or having maybe separation anxiety or fearfulness. Some of these sickness behaviors come before the urinary signs, and they can actually predispose to the disease, okay? Also, cats need their resources for themselves too. Availability and quality of the food and water they have can be a predisposing factor if it's not set up properly. Finally, I think too, a big one I see, and I don't know about you all, but multi-cat households. They're the most frequent chronic FIC ones that I see, and they're also the most difficult to treat, I find, because managing those can be difficult. Precipitating factors, as I mentioned, indoor environments, okay? Now, Dr. Lappin had a great picture of his cat up on that door, hanging out there, looking over that new dog that he loves. And we love that dog too, but the cat needs to feel safe. And just one little impact of an indoor environment are vantage points. Cats in this study were found if they had vantage points, or did not, I should say, they were at a 64 times increased risk of FIC compared to cats that had vantage points. A cat that's going to lie on the floor and relax doesn't want to be worried that its biggest predator is going to come attack it, right? That's not comfortable for the cat. Other things to consider with precipitating factors are early adverse life events. This is big in humans. We go through a lot of this in the human field. But I see this most frequently in my practice. At Davis, we have a very large and robust orphan kitten program. All right, most of these kittens, we don't have a mother, and they are bottle fed, and they are very young. And there are some studies in other species showing the separation can maybe lead to some of this altered stress response that I mentioned, disparity between that sympathetic system and the HPA axis. Maybe this is predisposing them to and precipitating the FIC events later in life. And I can tell you, these kitties that we do see, they have a variety of urinary issues. Many of them, too, have abnormal suckling responses. They suckle the prepuce of their litter mates, leading to urethral strictures, among many other issues. Finally, I think, too, we need to consider if they had previous stones or UTIs or things that might have set the bladder up to fail. Right? If there was inflammation to start with, and then we trigger it along the way. Now, the one perpetuating factor I wanted to talk most about is socialization. In humans, even the biggest introvert needs socialization. And humans are actually very social. Isolation can be a strong perpetuating factor of IC in human beings. And I think the one thing that really helped show us all of this was the COVID-19 pandemic. We saw a lot of depression, anxiety, and other issues that came up during that, and IC in humans certainly was one too. Cats are different though. Cats have what's called a facultative matrilineal sociality. And basically, of course, this is kind of intuitive. For cats, they can choose to be with you, or they might want to be social. That's cat's attitude, right? I'm going to spend a little time with my owner and run around, and then it's like, sorry, don't pet me at the moment. I need my quiet time. That's a cat, and that's what they do, and it's their choice. They may choose some of that, but they're not as dependent on that social network. But we house cats together all the time. Or I read a paper that said cats in the wild, there's generally one cat per 5,000 square feet. How many of you all have homes bigger than 5,000 square feet? Me neither. Just bought one, 1,200 square feet. Tiny. And I don't have cats now, but I used to. And when we house cats in that situation, we house them with their biggest predators, dogs and humans. right? And it could, in a certain cat, trigger them. It could perpetuate things. And that then activates the main biological thing that worries me, and Dr. Lappin mentioned, activation of the central threat response system. So I want to talk a little about that now. This was a study that was done by Dr. Haig, who's now a neurologist at University of Illinois, and she looked at the activation of what's called the acoustic startle response. So I think of this if you have a cat and the doorbell rings, what does the cat do? Does it run and hide under the bed, or does it come out and greet whoever is out there? It's kind of the startle response. She put the cat on a platform and basically made a sound about as loud as a hand clap. And you can see on that graph, the cats in red, the FIC, were definitely more startled and compared to healthy cats. But what's great is that environmental enrichment can improve this. We can decrease that startle response. But what it suggests is that these cats have a perceived inability to cope with stressors, which can perpetuate that inflammatory cycle. And I talked about the catecholamines being increased peripherally that we drew blood from and could measure those. We also did studies looking at what's going on in their brain. This is a picture, a schematic, looking at an area in the brain called the locus ceruleus. And that is located close to what's called the pontine micturition center. We found that there was a significant increase in what's called tyrosine hydroxylase, which is the rate-limiting step in catecholamine synthesis. So not only do they have increased catecholamines peripherally, but they have them centrally. And this also can exaggerate that sympathetic response. This then leads to a newer concept of the central threat response system where it's the CNS, it's activation of the autonomic nervous system, endocrine, and the immune and inflammatory system. So remember too that cortisol was not as robust as it should be. And if you look at that schematic, cortisol can act as a negative feedback at the level of the brain to shut down catecholamines, and they don't have enough. So again, this cycle begins to continue. But by thinking of things this way, this changes the nociception as opposed coming from the bladder up to the brain, from the brain down to the bladder. So this disease is maybe more a central disease and not just a bladder disease. So when you think about the inflammation of FIC, it starts with an insult, and then the pain and lower urinary tract signs are manifested. You might have a precipitating or palliating factor that stresses the cat, makes the inflammation worse, and the cycle goes round and round. And that brings up a concept of what's called nociplastic pain. I think it fits really well for FIC. And this arises due to this kind of altered nociception that I've just described. And there oftentimes is not evidence of tissue or nervous system damage. We don't see that the cat looks outwardly okay, right? Even when we scope their bladders, sometimes their bladders look fine, but they have multiple abnormalities going on that result in their signs. So we know chronic stress clinical signs are exacerbated by the cat's perceived threats associated with sickness behaviors. So it ends up with the sensitive cat and the provocative environment. Those two cats sitting on the lawn chair there, you can't see it, but they're giving each other some serious side eye. They are not happy, and I know this because they're my cats. They were. And they did not like one another, and they were stalking their territories. The other cat feels comfy enough to hang out and take a nice nap in the sun, all right? So we have to look at our environment to see what will trigger. So this brings us to preventive factors. Ideally, we would love to intervene really early so the cat never develops these signs. We can work with breeders if we see things in line, so education's important. But the main way, too, for prevention and palliating is what we call multimodal environmental modifications, or MEMO therapy, to enrich the environment, provide abundant resources and choices. Palliating factors can help us address the fact that there's no cure for this disease, but we want to increase the disease-free interval by normalizing the central threat response system, providing a safe and predictable environment for the cat, and we need to tailor that environment not just to the cat, but for the owner, right? These cats aren't coming in on themselves. This is all owner dependent. So let's look at a case. All right, this is Perseus, 5-year-old male castrated domestic short hair who presented for recurrent lower urinary tract signs of 1 year. Prior to seeing us, he had had 2 urethral obstructions as well. He was on 7 medications, all by mouth. I'm sure Dr. Scheinberg would be an expert at pilling that cat 7 times, right? I was kicked out of 2 clinical trials with my cat because I couldn't medicate my own cat. It's hard, and this owner was doing this, and we know stress can exacerbate it, and this cat and these owners had had enough. In part because these cats, his clinical signs where he was feeling well were getting shorter and shorter, 4 to 5 days. He had many urinalyses. They were read out as normal. He was adopted as a kitten. He lived with 4 cats and 3 dogs, but he got to go inside and outside. He had a pretty posh life. He lived outside in the upper northern area, coastal area of California. I'm sorry, his diet was raw meat and canned food. We slowly addressed this. I did not want to overwhelm my owner. I do not condone it. Physical exam, the main highlights, this is not Perseus here, but it's how I photograph cats that are obese or overweight. I like getting some top-down photos, and Perseus was overweight. And he had a heart murmur, which is a common comorbidity we see in these cats. His bladder was small, so he wasn't blocked. Great. Let's go back and think of our differentials. For his signs, FIC, recurrent problematic. He is a challenging cat. But remember, he was catheterized a few times, so I don't want to get tunnel vision. Maybe he has a urethral stricture or trauma from the catheterizations. Could he have a stone or an infection? So whatever diagnostics we do, we have to tailor it to the number of episodes, how much money our clients have, how attached they are to the cat, and what resources you have in your area. So what would you do for Perseus? It's a recurrent case. We're going to work him up a little bit more. He did receive a radiograph. He had no evidence of stones. We did an ultrasound that is not his. We wanted to look for non-radiodense stones. His showed a slightly thickened bladder. We did a urinalysis. He had a very concentrated urine at 1054. At least that let me know that he is voiding outside the litter pan was not associated with polyuria. Okay, so it is helpful to see that. He had crystals, struvite, which we'll talk about later on how that can affect him as far as the potential for being blocked. But crystal urea does not damage the urothelium itself. It's not a disease. We did blood work, which is essentially normal, and I did it in his case because he was on chronic medications that are off-label, and I want to make sure they're not causing any harm. You can see on his CBC he had a slight left shift with bands present. I'm going to be very honest, I don't know the cause of it. This is a real-life case, and sometimes we don't figure it out, and it resolved. We then did a cystourethrogram. I'm going to show that right here, and you see the contrast going into the bladder to make sure we didn't have any urethral strictures. It's important when you're doing this study to distend the bladder well, or you won't get good urethral distension. And we were able to rule out any strictures in this cat. We did this using fluoroscopy. You do not need fluoro. You can use plain radiography. Should we scope him? Well, I can tell you scoping male cats is difficult, and we didn't. But this is a female cat, just to show you that sometimes you can see all this floating material and blood and other things in the urine. And keep this in mind for the next hour when we talk more about the blocked cat. When he was discharged real life, he came back with signs very quickly. He cultured a pathogen. We did treat him with antibiotics. I personally think this was subclinical and this was FIC again, but this is what we had, and the clinician did treat him with antibiotics then, and it never came back. What I think the mainstay initially is analgesia. You can consider things like gabapentin, that's used primarily the most, non-steroidals, so long as they're eating and drinking well, and some people use some of things like buprenorphine and narcotics. A lot of the bladder-centric therapies, things like glycosaminoglycans, we've studied resnifratoxin, bladder hydrodistension, other types of anti-inflammatories targeted for the bladder. And even in humans, they've done partial cystectomies because the pain was so bad. But guess what? No long-term management has been shown to be that effective when you're looking at the bladder. And to illustrate this is a study, this is just an abstract, but it was a drug that was approved in humans, pentosan polysulfate, because this glycosaminoglycan in the cat has been shown to have less than in healthy cats, so the urothelium is exposed to those noxious stimulants in the urine. And they did a multi-center placebo-controlled trial, and they gave the pentosan polysulfate on a treat twice a day. And on the y-axis is the symptom severity, and the x-axis is time. And those lines are different doses of pentosan polysulfate. One of those lines is the placebo, which brings me to a placebo effect. And it can be either a caregiver placebo effect or most likely in some of these cats, placebo by proxy. Caregivers can directly influence the subject. And I will tell you a very similar study in humans was done many years ago looking at this drug and found to be great. Subsequent studies, when they did placebo-controlled, found no difference from placebo. So this brings us to the treatment that I think works the best, which is MEMO. And it helps to know those 5 Ps so we can tailor the MEMO to that cat in that environment with those owners. And that might depend what you should do. Maybe it's just a handout and say, these are suggestions. If the cat's worse than that, you're going to need more. We're going to need a tailored history, counseling, or maybe you set up support groups with your nurse or technician and these owners. This is an example of a worksheet that I use. I'm happy. Feel free to email me. I can send this to you. The top here, we look at, again, what's going on in the household, how many cats they have, how many dogs, kind of get a baseline. And then in the middle, we like to look at, what are some of the behaviors the cat expresses? Does it hide, act fearful? Is it the life of the party? It depends, and there's very different behaviors they express. Diet histories are extremely important, and I don't like when I read the records and they say canned and dry. I want to know how much dry and how much canned. Are they putting a tablespoon of canned on the dry food, or is it 75% canned and a sprinkle of the dry? If I don't know what they're actually feeding, I don't know how I'm going to change it, okay? Other part of this lists a bunch of sickness behaviors and comorbidities. And we are looking at this at a current study right now, so there's 2 different time points, so we can see how the effects of our therapies will improve how our therapy will improve those sickness behaviors as well. So consideration, we look at space. I've made references to that and how cats need their own resources, play activity, litter boxes, the 1 litter box per cat plus 1. Well, cats should have 1 resource per cat plus 1. Their own safe feeding area and water bowls, trying to decrease conflict to keep the environment consistent. So I don't believe in most cats that a dietary change is necessary in all cats, okay? I'll talk more about diet and hydration and FIC, though, in the next hour, so it'll be a little cliffhanger. Is high moisture needed? I'll let you know. But the most important thing, too, is to permit the cat and the owner to express their preferences. If you feel canned food is best, we'll look at that and see how that should be implemented. If the owners don't want to feed it, it's never going to work. In addition, I know Dr. Lin mentioned this, it's not just what we feed, but how we feed. They need a safe feeding area, particularly in multi-cat households. Maybe individual feeding stations. I love puzzle feeders and activities. And I probably don't rotate my food as much for my cats, but I do rotate their toys. They need that environmental stimulation and enrichment, and rotating them out provides some of these cats what will be really beneficial to decrease the central threat response system, okay? And increasing water might help. Increasing hydration might help. I'll talk about that more in the next hour, and even things like hydration supplements. Now, the last couple of slides here, I just want to talk about what we could do that might be more prevention instead of palliating. And this study comes from rodents, and they looked at a stressor with neonatal maternal separation-induced visceral pain. So the stress was, again, I like to think of it as orphan kittens. It was neonatals separated from their moms, okay? And when that happens, they became stressed, and they had quite severe signs. And what they found, and this is a quote directly from the paper, that environmental enrichment, and in my mind, similar to MEMO therapy, before adulthood, so even after the adverse life event the little rodent had, could be very important in guiding to significantly improve their clinical signs associated with visceral pain, anxiety, and depressive behaviors. We can reverse this. So I think it's really nice if we know what's triggering you, get a good history looking at that, we might be able to alter things. It'd be great if an owner came into you and said, Doc, I'm going to get a kitten. Can you please tell me from start to finish how I should keep my environment before I go get that kitten? Unfortunately, they usually come to us when the problem arises, okay? So looking at a current model of IC and how I look at things now, I think about evolution and how the cat evolved and what's its genetic risk factors. And then maybe through development, they might get some protection. It depends on their susceptibility and resistance. And then what life events are going to occur that precipitates an outcome. And depending on what's either there to be perpetuating or palliating, could result in other sickness behaviors or hopefully recovery. And it's up to us to kind of tease through and tailor all of this for them to help improve the welfare of our cats in their indoor environment. And with that, I'm happy to take any questions or comments.